And I'm Kevin Holmes. As we speak, hundreds of nurses at North Memorial's Maple Grove Hospital voting whether to authorize a strike.
This comes after more than a year of contract negotiations. It is the latest twist for Twin Cities healthcare. Just days ago, Sanford Health and North Memorial agreed to combine as a nonprofit health system, which sources say will help stabilize North Memorial. Also, the future of HCMC is up in the air, with bills right now working through the legislature to address that hospital's massive financial crisis. Heidi Wigdell heard from nurses this morning and joins us with our top story. Heidi?
Julie, if approved, it would give the bargaining team the authority to call a strike if they believe it's necessary. There also would need to be a 10-day notice given to the hospital before any strike could happen. The nurses I spoke to said they're hoping it doesn't get to that point.
For the past year, the nurses at North Memorial Health's Maple Grove Hospital have been negotiating their first union contract. Now, with no agreement reached, nearly 600 nurses with the Minnesota Nurses Association are voting on whether to authorize an unfair labor practice strike.
Nobody wants to leave the bedside. We want to be there for our patients, so the hope is that we will see forward movement.
Wendy Gustafson, a neonatal intensive care nurse at the hospital, says they're pushing for increased staffing. They also want to see equal pay and benefits with nurses at North Memorial's Robbinsdale Hospital and protections in case of a sale or merger. Just last week, North Memorial Health and Sanford Health announced its plan to combine into a single nonprofit health system.
It doesn't matter whose name is on the building to us, honestly. We care about our patients and the nurses that we're working with.
North Memorial Health referred us to their previous statement saying, quote, "We remain engaged with the nurses union in good faith negotiations. We are committed to reaching an agreement that supports the organization's long-term financial stability, enables the continued high standard of care we deliver to patients, and ensures a positive working environment for our nurses and teams."
We are really worried about the retention of our nurses. We don't want to be striking. It's a last resort. However, we really feel passionately that patients are our priority, and this will help us get there.
Nurses will be voting until 9 tonight and will be back at the bargaining table with the hospital tomorrow morning. If a strike is called, it would be the first in Maple Grove Hospital's history. Julie.
All right. Thank you, Heidi.